I think one of the biggest strengths that we have is continuity of care with our patients. It's really the tenet of family medicine is taking care of patients across, throughout their life and across different settings.
Our goal in developing our future residents or future physicians is really to make an all-around good doctor. That's what family medicine is.
Making sure that they're well trained in the core principles of family medicine, including procedures, building camaraderie and advocacy.
To practice empathetic, patient-centered care. We want them to be lifelong learners with a focus on quality, and we try to teach that throughout their experience.
I actually rotated here before I applied to residencies while I was in med school, and I just fell in love with the program right away. It's very rigorous in the way that it teaches you, and they want you to learn and they push you, but also it's kind of a program that wants you to excel.
One of the ways that our program stands out, I think, from the rest of the top programs in the country is that when the residents come in, we allow for a transition block.
And basically what that means is that we got slowly exposed to, like the EPIC system of where we patient chart, we got exposed to the clinic, we got exposed to the different rotations. And that way, when we actually started residency, we were able to just kind of dive in.
Our program prepares residents for comprehensive family care by having inpatient and outpatient rotations that prepare them from an internal medicine, family medicine, obstetrics, and pediatric perspective to take care of patients across, all age ranges.
The outpatient clinic experience is very diverse. We have all ages and all stages of disease. So you do chronic disease management, acute management.
We have 6 electives for the residents over the course of their training where they can choose, pretty much whatever it is that they're interested in.
As a family medicine physician, you are supposed to take the entire picture of the patient, whether it's mental health, whether it's physical health.
We encourage residents to take a holistic approach, whether the patient is here for an acute visit or a chronic visit. We want them to take a step back and make sure that they're not just treating physical symptoms, but taking a look at what the patient might be going through mentally as well. So it's truly a holistic approach.
One of the unique things about Eisenhower is that we have a very diverse patient population here. So we get to see patients that are uninsured. We get to do rotations such as street medicine, where we get to work with our homeless population. We get to see patients that are predominantly Spanish speaking or of another ethnicity, and that kind of allows us as residents to build very good rapport with patients, but also get exposed to just so many different medical problems and patient population.
At Eisenhower, we offer a great camaraderie with the residents. I think that we have a very committed faculty that's dedicated to individual and personalized time and education.
We have a culture of kindness. That was one of the things that actually drew me to Eisenhower is the approachability that all the faculty and staff have.
So I like to think of our residency program as a community of people here to support you to become the type of family medicine doctor that you want to be when you're done.
All of us residents really enjoy our time together.
We're able to kind of build a foundation that doesn't just make us just co-workers, but it's more of a friendship as well.
I got a real good group of lifelong friends in the residency.
So our graduates go on to match into multiple fellowships: sports medicine, addiction medicine, and obstetrics fellowships. And geriatrics is also another common fellowship that a lot of our residents match into. Again, it speaks to the full spectrum training that our residents get.
I mean, it is California, so that is always the positive.
I mean, you just have to look around. It's beautiful. You live in a resort city.
You have great restaurants. You have a lot of things to do. You have Joshua Tree right here if you're a little more outdoorsy.
Great music, great festivals, great hikes. So it really offers a lot, and about 350 sunny days a year doesn't hurt either.
A lot of our faculty are actually graduates of the residency programs here, so them staying on says a lot about Eisenhower.
The residents have a great experience from when they get here to when they leave, and when you're treated that well, when you're treated that way, it makes people want to stay.
If you're wanting to come to a program that will see you, that will hear you, and to a program that will honor full spectrum family medicine training, then we are the place for you.